conversation on SuperTalk Mississippi.
And now, it's Coast Vue with Ricky Matthews. Brought to you by J. Allen Toyota, Gulf Coast Business Supply, and AGJ Systems and Networks on SuperTalk 103.1 FM.
Welcome to Coast Vue, the show that celebrates the men and women who are making coastal Mississippi such an amazing place to live, work, and play. Hey, listen, the tourism situation, as you've been hearing here on Coast Vue, is really doing well. The numbers at the casinos is incredible. You just see the collaboration that occurred in our community to make it so that people who come here from outside our market to enjoy coastal Mississippi, we want them to feel safe. And all those efforts are really paying off. The gaming numbers in some cases are hitting records, and it is really incredible. But because of that, though, we've got to stay focused on the message we're sending the world, especially here in coastal Mississippi, about vaccinations and why that's still an important conversation with the Delta variant that's coming out. In just a second, we're going to be joined by Dr. Nicholas Conger, the infectious disease doctor from Memorial, and we're going to talk about that. And then in the second half, we're going to be joined by Paige Roberts, a good friend of Coast Vue, the president and CEO of the Jackson County Chamber. And she's going to share an effort that's underway to try to get the vaccination numbers up. And I look forward to being joined by Paige. So anyway, today is really a day focused around vaccinations and COVID and finding out what the latest is. Let me share a couple of little quick positive thoughts with you. This is from Sherry Carr Beavis, a friend of mine. She's a very positive person. She posts wonderful things. This is from Live a Happy Life. A positive mind finds opportunity in everything. I can't agree more. That's always been the approach that I want to take. I've mentioned Zig Ziglar many times early in my career. He may have had a really big influence on me. I read just about every book he's ever written. And he said this: be thankful for closed doors, bad vibes, and stuff that falls apart. It'll protect you from the things not meant for you. I just think that's perfect. Absolutely perfect. And one last one from Mark Wahlberg. He's, the actor. He contributes greatly to the community and had a lot of success in his life. But what he said really touched me, and I totally agree with him. He said this: God never gives you a dream that matches your budget. He's not checking your bank account. He's checking your faith. I totally agree with that. And we talk a lot about dreaming and inspiration here on coastal Mississippi, on Coast Vue, and I hope that gives you something to be hopeful about and to think about, actually. So now let's shift gears and move over to my friend, Dr. Nicholas Conger. For those of you who have been regular listeners of the show, you know that we have become friends over the past well over a year. He's an infectious disease internist at Memorial. He has been super engaged, as you can imagine, in the COVID response. And he's been, as I said, a really good friend to the show. So without any further ado, how you doing, Dr. Conger?
I'm doing great, Ricky. Thanks for having me back.
It's good to have you back. Hey, listen, we have a lot to talk about today because I want to kind of set things up around the latest, learn a little bit about the Delta variant, and share some numbers, and really kind of cover the waterfront. And we'll do two segments on that, and then Paige is going to join us after this, or join me after this, and we're going to talk about some efforts underway to try to get our vaccination numbers up. So before we get into numbers and Delta variant and all that stuff, why don't you just tell me about what you're experiencing today, what your thoughts are today around COVID?
So, I think that if you look back at what we talked about months and months and months ago, we talked about how do we get out of this and how do we get back to a new norm. And our dream was a vaccine. And I never thought that there'd be one available so quickly that is so effective. And so we saw the numbers drop dramatically. But during this winter surge before the vaccination came out, we were, the hospital was full, 30 plus patients. We had ICU extensions, extra ICU beds, extra ICU nurses, lots of patients on ventilators. And we saw that just drop like a rock. And so now we're kind of in this, we're getting closer to a new norm where this is a low level infection through the community. And kind of what's going on now is we is I think, it's almost all of our cases, about 95%, maybe even more, are in unvaccinated people. The vaccinated ones that have breakthrough cases are having very mild cases. It's only rare that someone who's been vaccinated is sick and about to die from COVID. And that's usually because they have underlying immune problems where the vaccine didn't work because of say their cancer or their chemotherapy. And so what we're seeing is kind of a new norm of low-level COVID that's still quite contagious, still quite capable of making people sick, but low enough to where it's not affecting hospital day-to-day operations. It's not overwhelming the healthcare system. And so what I've been saying for a while now is that we're at a point where people are either going to get vaccinated or they're going to catch COVID. One or the other is going to happen, I think, to almost everybody over the next few months to a year if we keep going the way we're going.
And that's a pretty significant message. Now, for someone who's not in the vulnerable class, that may not be so troubling a message. But I know someone who just in the past few days, after being on the ventilator for an unfortunate amount of time and fighting hard, unfortunately died from COVID. And, one of the things we talked about before was that we've done a really good job. When you look at the numbers, we've done a good job across the state in vaccinating people who are up in age or who are vulnerable. Although there are still people who are up in age and who are vulnerable who have not been vaccinated. What do you say to them, especially these days?
There's lots of reasons why people may or may not be for or against these vaccines. What I consistently tell people is that I know many, many people who are vaccinated, myself included, and I know many, many people who've had COVID, and I've taken care of hundreds of them now, probably close to thousands. And I would much rather take my chances with this vaccine. I think the vaccines are safe, but if you're worried about the vaccine, I'd much rather take my chances with the vaccine than with natural infection. Now, yes, the young and healthy, the little kids, that's a different story. We can talk risk-benefit because the risk-benefit ratio is different for them. But when we're talking about people in their 50s and 60s who may not be as healthy as they think, especially if they're a little bit overweight, especially if you start adding risk factors like diabetes and high blood pressure, especially with these new strains being a little bit more aggressive and a little bit more contagious, it's going to go through the 50 to 60-year-old population that aren't vaccinated pretty quickly. And most of them are going to catch it, and some of them are going to die. And so it's not, like I said, it's not going to be this huge overwhelming push in the hospitals, but it's going to be this low-level churning throughout their healthcare system, and people and their families are going to be affected by it.
Yeah, we'll get to kids in a second. So let's kind of start from the top here. I'm looking at some of the data from Mississippi, and it kind of breaks it all down. Harrison County, let's see, what is the time frame here? Well, last 14 hours, 5 new cases, 1 death, 317 deaths total, 18,386 cases. Jackson County, only 1 additional case in the last 14 hours, 13,678 have had it, 248 have died. I could go on from there, but what's important is that if you look at the rolling averages, things have certainly leveled off. The number of cases, the number of new cases in Mississippi was only 47. And if you look at the 7-day average, it's about 121 cases. In terms of where we were before, that is unbelievably positive. Okay, now look, how many of those new cases, that 47 new cases, are people who are older and vulnerable, or in a vulnerable class? We don't know that. We don't know that from looking at this data. So, the reality is it's still here. And if you are in the vulnerable class or you're older and you have not been vaccinated, you need to get vaccinated. And I know you've made your choice, but it's not too late, because if you get COVID, as Dr. Conger has said, your chances of dying are much higher if you get COVID versus if you take a vaccine. So why don't we do this for just a second, Nick, and let's review for a second why you believe strongly that the 3 current vaccinations that we have available to us are safe.
Okay, so in a brief comment on what you just said. So clearly the case rates are more important than the vaccination rates. Yes, we want the vaccination rates up. It is good news. Our numbers are that low, but this has become a vaccine preventable illness, period, and so people are choosing. And I had a family conference recently with a family member who was just so angry, their loved one doing so sick, doing so poorly, maybe going to die in a few days, so angry that we weren't doing experimental drug A or experimental drug B. And I thought, well, gosh, these drugs aren't proven. We don't know if they help or not. It's a virus. Viruses really run their course. And I was thinking a much, much better approach is to get vaccinated. There's people who weren't vaccinated, and the family member said, well, what can I do? And I said, well, I'd go and get vaccinated. And they said to me, well, I've already had COVID recently. And I said, well, then I would tell everyone how sick your loved one is, who's not vaccinated, and pass it on. Just because like I said, it's vaccine preventable. So, and people are able to make their own choices now. But by and large, the vaccines that are out there are safe, and they're much safer than COVID.
Why don't we do this? We're coming to the end of the segment. When we come back, we'll pick it up there, talk about the unique technologies involved in the development of vaccine. We'll remind people about that and why there's a strong belief that they're safe. I want to get into the Delta variant and why that specifically is spreading rapidly. So starting in India, and then here we are today. It's the most profound case that we see these days, or at least the variant we see these days. I want to talk about kids, and this debate that's going on in America about vaccinating our kids, and get your thoughts about that as well. We'll continue the conversation with Dr. Nicholas Conger after this break.
Coast Vue on SuperTalk 103.1 is brought to you by J. Allen Toyota on I-10 exit 38 Gulfport. See all the incredible inventory at allentoyota.com. And remember, when you think Toyota, think J. Allen Toyota.
Hey, South Mississippi, it's J. Allen at J. Allen Toyota, and I got something new for you for 2021. It's the J. Allen Certified Collection. What that means is we selected our very best inventory with under 75,000 miles, and they're 6 years old or newer. That comes with a multi-point inspection, a 10-year, 100,000-mile warranty, and a 3-day buyback guarantee. So come check out the J. Allen Certified Pre-Owned Collection right here, I-10 exit 38 in Gulfport, or on allentoyota.com.
The streets of downtown Gulfport will be lined with food trucks this Saturday for Ugly Tie Fest. Finally, a festival for Dad. Ice-cold beer, great live music all day, classic motorcycles, and delicious food truck food. So come hungry and ready to have some fun. Bring your dad and the whole family to Ugly Tie Fest in downtown Gulfport, Saturday, 11 a.m. to 7 p.m. Admission is free.
SuperTalk Mississippi.
From outer space, visitors from another world. We've had contact with bug-eyed monsters.
This is actually a flying saucer.
Flying saucer?
I'm from another planet.
Where late nights are kind of weird.
Well, they must have a reason for their visits.
The unexplained, the weird, and the downright creepy. Coast to Coast AM with George Norrie. Late nights. SuperTalk Mississippi. If Alexa's part of your life, you've got one more way to access SuperTalk. SuperTalk Mississippi is now available on Amazon Alexa devices. Once enabled, just say, Alexa, play SuperTalk Mississippi at any time and start listening. It's that easy. Just one more way to stay informed and connected with your state. Learn more at supertalk.fm/Alexa. SuperTalk Mississippi. SuperTalk Mississippi. Now available on Amazon Alexa devices. Feeling down? Here's your prescription for a daily dose of good news and positive vibes. Good Things with Rebecca Turner. Every afternoon, Rebecca highlights all the good things happening right here in the state you call home. Daily exposure to Good Things with Rebecca Turner may cause smiling, feelings of positivity, happiness, and even laughter. When you experience these symptoms, tell your friends to listen.
Okay.
Weekdays starting at 2 p.m. here on SuperTalk Mississippi and now on Amazon Alexa devices.
106.3 Casino Radio is here. Tune to 106.3 to discover all of our must-see attractions and everything that's happening at our 12 incredible casino resorts. Where to eat, where to stay, what to do, and where to play. 106.3 Casino Radio has you covered with everything you need to know to help make your visit here to the coast one you'll never forget. Turn on 106.3 Casino Radio or listen now on our website, CasinoRadio1063.com.
Talking to the people that help make the coast such a unique place to live. This is Coast Vue with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome back to Coast Vue. We're having a conversation with Dr. Nicholas Conger, longtime friend of Coast Vue and mine. He's an infectious disease internist at Memorial. Nick, when we went to break, it's always interesting because when you and I get off between the segments and start talking offline. By the way, I hear your phone, but that's fine, man. You're a doctor. You're being called upon. But one of the, it's always interesting the conversations that you and I have offline. But one of the things I was saying, a person that I quote regularly here on Coast Vue is a guy that I had the opportunity to meet at Northwestern University named Robert J. Danzig. He was the chairman of the board for Hearst Corporation. And one of the things that he said that I kind of took with me into my career and quoted him often, quoted him again on the show often. He said this, that there is a powerful lubrication to change that comes from pain. Talking about whether it's in your personal life and looking to be better, that sometimes we wait until we feel too much pain before we actually change. And his point is that don't wait till you're feeling enormous change pain before you change. Just be focused on the incremental change as you go forward. As you apply this to COVID, you think about those families you mentioned, the families that I know about who could have been vaccinated, didn't get vaccinated, and now they're facing either a loved one who has died or could die. And that pain has caused them to really rethink their whole thinking around the vaccine. It's unfortunate that it took a level of pain before they changed their point of view. And maybe by sharing that story, by focusing on their situation, we can get others who have not yet felt that level of pain to rethink their whole thinking around the vaccine. Do you see it that way too?
Yeah, I do. And I'm not big on mandating things, especially things like vaccinations. I know it's a personal issue, and I'm going to do my best to encourage it. But yeah, so the question is, what's the incentive? And sometimes people don't realize it until it affects them personally. I did see some discouraging studies where they said that of the people who are not vaccinated yet, I think the majority, like over 80% of them, said that there was no data that could be presented to them that would make them change their minds. Man. And so, you talk about these incentive programs and different things. But like I said, if people can make a choice, people can make a choice. And we brought up those variants, these new variants, they're more contagious and they're more deadly. And the vaccine, the organism is going to keep mutating. And fortunately, the vaccine seems to work for these new variants as well. Like I said, I think people are eventually going to get vaccinated. They're going to catch the infection. And then if they do catch the infection, a certain percentage of them will get really sick and a certain percentage of them will die. And people are making that choice right now, whether they realize it or not.
They are definitely making that decision, whether they realize it or not. So let's come back to the vaccines. You believe that the option of the risks associated with getting COVID do not outweigh the risks associated with the vaccine. You believe that the vaccine is very safe. So let's kind of take us through them again to explain to people why what they might have gotten done quickly. And you make that a really, as an infectious disease doctor, you understand the technology and the amount of work that it takes to get to a vaccine. And you keep pointing out that we got here in record time, but we did not, other than the fact that we don't have time to really test it over a long period of time, that is remarkable that we got to this point. And tell us why you feel so strongly about them being safe these days.
Well, I think, right now time is pouring that out. They did. It's not that they were experimental. People used to say, oh, these are experimental. They're not experimental. They did speed up the approval process. A lot of the approval process for drugs and vaccines is, quite frankly, a lot of red tape and delays. And that was cut through quite nicely. So they did do, their due diligence with some studies, and the goal of every vaccine is to make you make an antibody. And so, we started off giving like live versions of viruses that don't make you as sick. I mean, if you go back to that, for smallpox, we were giving people a version of cowpox that wouldn't make people as sick, but would still give them sores on their arms. And your body would eventually make an immune response. And then we have killed viruses and killed bacteria and pieces of viruses and pieces of bacteria. This is just technology where it just goes straight to the core and just teaches your body immediately how to make the antibody to the spike protein, or actually how to make the spike protein, which your body immediately makes an antibody to. And there's a fourth vaccine coming out, Abbott, that's even different technology than that. And so for those who are hung up on the messenger RNA part of it, I believe this newest vaccine doesn't have that issue as well. So there's lots of choices. There's a menu of 4 vaccines, all pretty darn effective with low side effects. They're continuing to look at things. So young males may have some cardiac inflammation. It doesn't seem to be deadly. It seems to be very, very rare. And so we'll keep looking at those things, but by and large, they're safe.
So, we keep hearing about the Delta variant and a lot of concerns around it. What I read this morning, that some epidemiologists in the UK said that it was 40 to 60% more transmittable. Whether it's 40 to 60 or whether it's 30 or 70, it doesn't really matter. The fact is, it is well documented that it is more transmittable than any current versions of the virus. And so as we get through the summer and get back into the fall, and we continue to see that Delta variant be the sort of predominant version of the coronavirus, that's something to be at least partially concerned about, wouldn't you say?
Yeah. And I wouldn't necessarily get hung up on the names of the variants, because they're going to come and go. The virus is going to keep mutating and mutating and mutating until it either reaches a steady state or the level of transmission is so low. But yeah, certainly, like we said, I think that's just going to contribute to what I mentioned earlier, that there's going to be this low level churning. So we're at a new norm, and we got to kind of try to go back to life as normal. The life as normal is going to be with this low level of cases occurring, continually.
Well, look, one other thing I want to mention, and then I have something I found on Healthline that I want to share with you and just kind of get your thoughts about it. It's really about the headline is how you encourage others to get vaccinated makes a big difference. And I just want to get your thoughts about it. But what's your current thinking on kids? I mean, you see the national media are hung up on kids getting vaccinated. CDC is big time engaged in that as well. What are you thinking?
Well, I personally think that we need to take a step back, and I say, like, everything's a risk-benefit ratio here. And the vaccines, I do not think, are risky, and these studies are showing that they're safe in children. That said, I'm not sure if I'm going to rush out and get my younger children vaccinated, because the infection is really not that deadly. I mean, it really doesn't affect kids much at all. And so certainly I think I would be more incentivized to get a vaccine if the infection was worse in kids. And so I think that you would have to weigh the risks and benefits of infection versus vaccination, because in that group, it's more of an equal relationship. I would much, much, much rather see us really push the programs out on the vulnerable and the adults. I don't think they're trumpeting enough a few things that are true about the vaccine or true about the virus, one of which is really obesity. It's a major, major, major risk factor. If your only risk factor is obesity, you can die from this virus. They really need to push that out. And people who've had COVID probably don't need to rush out and get vaccinated. So we need to add the recently infected and people who've gotten over it to the numbers of immune and look at immune populations. But man, I'd much rather push it towards the older folks. And for the kids, I'm not gonna push it on the kids yet. Now, see, the virus can mutate though and become more deadly, more aggressive, and more dangerous for children, and that would change the equation. I think I have a sit back and wait approach.
You have to act on what you know today. Paul Gallo from the Gallo Show on SuperTalk, #1 show in the state of Mississippi, I might add. And I had a conversation about this. We were talking about our grandkids. I have 4 grandkids. He has grandkids. My daughter's a teacher. You know that. She teaches at St. James at 6th grade. And I watched them in classes, and they just didn't really encounter COVID as a problem this whole school year. I know that some schools had a little bit of it, but no major concerns about that, frankly. And where he and I were, where you are, unless something changes materially, we're not really pressing this issue with our kids. And so if new information were to raise, we would address that. Right. But I think the key is that we just have to get the adults around them vaccinated. I mean, that's the key.
Yeah, and another changer of that equation would be if you have someone who's immune compromised in your home, particularly if you don't think vaccination for that individual will work to protect them, that might be an incentive to get everyone around that person vaccinated, including younger children. So there is going to be a role. There's going to be some times where definitely the equation goes towards vaccinating the children. But like I said, for now, I'm going to sit back a little bit and watch how this plays out.
Okay, so this is the thing from Healthline that I mentioned to you. The headline on the story is how you can encourage others to get vaccinated how you encourage others to get vaccinated is the difference. The first point is many people continue to have concerns and doubts about COVID-19 vaccinations despite overwhelming evidence that they are safe and effective. We've dealt with that. We already talked about that. Experts say it's important to talk about vaccine hesitant friends and family, the need for everyone to get vaccinated so that we can end the pandemic. And we're almost out of time. This is really important. It says shaming or arguing does not work. Instead, listen to their concerns, give the facts, and then let them decide. That's kind of where you are. Just give them the facts, and people are going to make a decision one way or the other.
That's right. And that's right. And like I said, I continue to say, people are either going to get the infection or get vaccinated, but some people who get the infection get sick and die. And so just take that into consideration.
Dr. Nicholas Conger, our friend from Memorial, it's just been terrific throughout this entire pandemic. Thank you for joining us, buddy. When we come back, we're going to have Paige Roberts, the president and CEO of the Jackson County Chamber, and we'll continue this conversation. See you after this break.
Listen live or on demand and watch episodes of Coast Vue on your laptop, desktop, or on your phone or tablet by going to SuperTalkMSGulfCoast.com.
When COVID started, Gulf Coast Business Furniture and Supply began stocking very hard-to-find PPE items to make our community a safer place. When Amazon and other mega internet companies were out of stock or inflating prices, Gulf Coast Business Furniture and Supply was providing local schools and businesses vital PPE supplies at fair prices. They were even sending thousands of dollars of PPE supplies free to local schools in need with help from other local business leaders. The next time your office needs PPE supplies, office furniture, or products to keep your business operating, consider a local company that supports your ball teams, cheerleaders, and area homeless. Consider Gulf Coast Business Furniture and Supply, the local guys that keep your prices fair, your service and selection excellent, and your health our business. Gulf Coast Business Furniture and Supply. We sell that too. Buy local.
SuperTalk.fm has a new look and is more informative than ever with expanded Mississippi news coverage, the latest Mississippi weather, Mississippi sports, and of course, the talk that's important to you. Every show, every podcast, and every late-breaking story. Constantly updating the news the second new developments happen. All in one place. The new SuperTalk.fm.
106.3 Casino Radio is here. Tune to 106.3 to discover all of our must-see attractions and everything that's happening at our 12 incredible casino resorts. Where to eat, where to stay, what to do, and where to play. 106.3 Casino Radio has you covered with everything you need to know to help make your visit here to the coast one you'll never forget. Turn on 106.3 Casino Radio or listen now on our website, CasinoRadio1063.com.
Hey, South Mississippi, the future has arrived. It's 2021, and at J. Allen Toyota, we're here to serve you. Want to let you know that we have Allen's lifetime warranty on every new Toyota we sell. That also comes with Toyota Care. That's 2 years and 25,000 miles of complimentary maintenance. We have a great rental department. Our service department's ready to take care of your current vehicle. We're rolling out J. Allen certified pre-owned for 2021. You got to come to I-10 exit 38 right here in Gulfport. You're going to love what we have to offer. When you think Toyota, think Allen Toyota.
Feeling down? Here's your prescription for a daily dose of good news and positive vibes. Good Things with Rebecca Turner. Every afternoon, Rebecca highlights all the good things happening right here in the state you call home. Daily exposure to Good Things with Rebecca Turner may cause smiling, feelings of positivity, happiness, and even laughter. When you experience these symptoms, tell your friends to listen.
Okay.
Weekdays starting at 2 p.m. here on SuperTalk Mississippi and now on Amazon Alexa devices.
Hey, I'm Steve Azar, and you never know who or what you'll hear when I spend a Mississippi Minute with my friends. Talking to Paul Thorne, Mississippi true treasure, really incredible recording artist, singer, songwriter, has been doing it a long time, doing it the right way.
It's almost like a Forrest Gump thing because, I was a boxer, / I worked in a furniture factory, / I had a gig 2 nights a week playing my acoustic guitar in a pizza restaurant, / I was in the National Guard, and,
Wow.
All this stuff was going on at the same time. / I had a writing contract with Rick Hall and Fame.
In a Mississippi Minute. Be sure to check out In a Mississippi Minute with me, Steve Azar, right here on SuperTalk Mississippi, the SuperTalk Mississippi app, and now available on iTunes, Google Play, and Stitcher.
Whether you're brand new to the DIY craze or a seasoned veteran, the Handyman Show has something for you. Buddy Slowick shares tips and tricks on everything from odd jobs to complete build-outs, from small home repairs to serious construction. So no matter if you're at the master carpenter level or not quite sure how to use a level, the Handyman Show answers your questions with a healthy dose of humor and some great music too. Saturdays, 10 to noon on SuperTalk Mississippi and on SuperTalk TV. SuperTalk Mississippi.
Just seems to me people have so much invested in not telling the truth.
When you want the truth.
Simply because it might hurt some feelings.
And nothing but the truth.
Lose some subscribers.
You want the Gallo Radio Show.
I just think in this audience, you still believe that if you tell the truth, you come out ahead.
The Gallo Radio Show.
And if you tell yourself otherwise, you're lying to yourself.
Mornings on SuperTalk Mississippi.
And now, it's Coast Vue with Ricky Matthews. Brought to you by J. Allen Toyota, Gulf Coast Business Supply, and AGJ Systems and Networks on SuperTalk 103.1 FM.
Welcome back to Coast Vue. Really enjoyed my conversation with Dr. Conger. Today, we're actually dedicating the show to the vaccine and COVID and where we are as it relates to all of that. And as I mentioned, now we're going to be joined by Paige Roberts, who's the president and CEO of the Jackson County Chamber. She's a regular on Coast Vue. And she's working with chamber leaders and other business leaders across the coast to think about ways that we might be able to get the vaccine up. And Paige, you can come on in. Let me say good morning to you. Then I want to share a quote with you. But how are you doing this morning?
Good morning. I'm well. I hope you had a nice Father's Day.
I always do, man. As you can imagine, I have wonderful kids and some beautiful grandkids, and Father's Day is a special day for us. And
Sure.
hopefully the rain is behind us now. Mark Wahlberg, I shared this at the beginning of the show. He said this: God never gives you a dream that matches your budget. He's not checking your bank account. He's checking your faith. That's true in your personal life, and it's true if you're trying to make a better community, isn't it?
Oh, it is. I haven't heard that one. And from Mark Wahlberg, that's really interesting. What I have heard is that a vision without funding is hallucination.
Well, and we both know it's not, because without vision, you can't, without visions and dreams and being able to paint pictures of what is possible, you can't get people excited, especially people who have the money to spend in your community. Can't get them excited about spending that money, can you?
Yeah. And, it's interesting that we're going to be talking about vaccines today, because isn't it really the same thing as fundraising, as you mentioned? What you're trying to do is get people to act in a way that you feel is for the greater good. And so whether that's donating your resources or getting preventative health care, that's what we're trying to do.
Hey, we had a great visit with Dr. Conger, and we got up to speed on the numbers and the latest on the Delta variant. He told us not to get too hung up about Delta because it's going to continue to mutate. What's important is that he says a lot more contagious and is more deadly. And the point is that people who are obese or have any of those risk factors, if you're not vaccinated, you're taking a significant risk. And one of the things he mentioned to me that it really got my attention, that when he's dealing with a patient who is critically ill and family may be wanting him to consider all these experimental drugs, it occurs to him during all of those conversations that the most important drug that they could have gotten is a vaccine ahead of that. And now the families are now, hopefully in these cases, these loved ones can make it out. I mean, we've had a friend recently die from COVID, but hopefully they can get it out. But the families can use this moment of pain for themselves to get vaccinated themselves and to spread the word to their friends and families that they need to get vaccinated. And his point is that the risks associated with getting COVID are much greater than the risks associated with getting the vaccine. And he really encourages people to get the vaccine. One other point, when people come to visit coastal Mississippi, one of our most important stories to this moment has been that we can assure them that they're going to have a safe vacation. And our numbers prove it out. We're doing extremely well. I've had Linda Hornsby on. We talked about the Hotel and Lodging Association and the numbers and how great they are. Had David Parker on, the Economic Development Director for the city of Gulfport. He talked about hotel occupancy in Gulfport. And I talked to Travis Lund yesterday from Beau Rivage, and it's their numbers are really good. All the casino numbers are incredibly good. But you know what? It's interesting because I still got this text from a friend from California who said Mississippi's vaccination rates are very low. What's up? So when someone asks you that question, how do you answer that?
I answer it with generational culture that is not focused on preventative health care. I thought that Dr. Dobbs, from our chief medical officer for the Department of Health here in Mississippi, said it best in an article last week in the Sun Herald, and that was our numbers with breast cancer, our numbers with cervical cancer, our numbers with all kinds of health issues where preventative health care could diminish those numbers, and they're not, because it's not something that we typically, historically, generationally have been very good at in the Magnolia State.
I agree that he's done a great job at that. I mean, you think about this issue around obesity and the prevalence of obesity in in Mississippi, and then you think about cardiovascular disease. You think about the poor counties, especially where and I've had terrific conversations with guests about the issue of people. A lot of people don't have a grocery store near their home, and really the way they get food is they go to a convenience store, and they eat convenience store food, and that's not very healthy. But
no,
what guides all of that is a tremendous amount of around them being uninformed. There's sort of a generational uninformedness about that, isn't there?
And the habits. I mean, I really think eating is a habit, and what we grow up with, what our grandmother makes for us, what we make for our children, what is accessible, as you said, that's where we're hurting in the state, and that is bearing out with these vaccine rates. I mean, I'm a vaccinator. I get my flu shot every year. So getting my COVID shot, if I have to get that every year, fine. Because the one time I didn't get my flu shot, I got the bona fide flu and it was miserable.
Yeah, I get that. And by the way, I should point out that for people who are not regular listeners of Coast Vue, Paige is a significant community leader, both in Jackson County and regionally. She's involved in building better communities. The Jackson County Chamber is just involved in so many different things. But she was a director at the Red Cross, so she's been in the media business before. So she's covered subjects like what we're talking about for a long time. And with the Red Cross, you were like smack dab in the middle of having these conversations, weren't you?
Oh, sure. I took the job just a year before Hurricane Katrina and was there for 7 years after Hurricane Katrina. But if you'll remember the swine flu, H1N1, that was a big discussion when we were at Red Cross, and all the things that would take place in a pandemic, and encouraged to read the Great Influenza book. The same guy wrote it who wrote Rising Tide. So yeah, I'm in the business of making plans for disasters, and one could say these are individual disasters when we're talking about our healthcare going down.
You heard the last part of the conversation with Dr. Conger when I said, from Healthline, this story that talked about how to encourage others to get vaccinated, how you encourage others makes a difference. And the last point was shaming or arguing does not work. Instead, listen to their concerns, give them the facts, and let them decide. And, Dr. Conger said all along that people are going to decide for themselves. They really are. We've done a good job of getting the older Mississippians vaccinated, although there's still these holdouts. And he really encourages that if you're older or you're in the vulnerable, class of people, that you really need to get vaccinated. Frankly, you need to get vaccinated, period. But by now, you've kind of made your choice. What do you say to people who still have chosen not to do it?
Well, for me, it depends on the person, because it depends on how I think they're going to receive information. So for the most part, I just talk about the health of everyone that's around them and their loved ones and what the consequences are, and that when we have greater vaccination, we have greater immunity, right? Yeah. But that's where, it really is a psychological issue, right? It's the same as advertising. We're trying to get people to buy into their health, into preventative medicine. And so what we're looking at, as you mentioned, a small group of us with healthcare providers and other marketers, if you will, about incentives and influencers and what might be incentives that would work, and who might be the influencers who can make the difference, because that people do respond to that. And I think we're seeing that in some other states.
The story goes on to say this, to kind of add a little fuel to what you just said. Okay, here's what it says. It can seem cumbersome to try and convince each individual person that COVID-19 vaccinations are safe and effective against serious illness and death. But sometimes those conversations are worth having, especially if it's with someone you love or someone who has contact with someone you love. Kenyon said there are essentially three groups: people who accept vaccines, people who are anti-vaccination, and people who are undecided. So the people who are anti-vaccination, you might be able to convince them. Certainly if they have a loved one who gets sick, maybe. But people who are undecided, those are the people we're trying to get to right now. When we come back, we'll continue the conversation with Paige Roberts about what we can do to get our numbers up in coastal Mississippi. We'll see you after this break.
You can also listen live to SuperTalk Mississippi Gulf Coast 103.1 on your Amazon Alexa devices. Once you've enabled the skill, just say, "Alexa, open SuperTalk Mississippi Gulf Coast."
SuperTalk.fm has a new look and is more informative than ever with expanded Mississippi news coverage, the latest Mississippi weather, Mississippi sports, and of course, the talk that's important to you. Every show, every podcast, and every late-breaking story. Constantly updating the news the second new developments happen. All in one place. The new SuperTalk.fm.
Hey, South Mississippi, it's Jay Allen at Jay Allen Toyota, and I got something new for you for 2021. It's the Jay Allen Certified Collection. What that means is we selected our very best inventory with under 75,000 miles, and they're 6 years old or newer. That comes with a multi-point inspection, a 10-year, 100,000-mile warranty, and a 3-day buyback guarantee. So come check out the Jay Allen Certified Pre-Owned Collection right here, I-10 exit 38 in Gulfport, or on allentoyota.com.
When COVID started, Gulf Coast Business Furniture and Supply began stocking hard-to-find PPE items. When Amazon and other mega internet companies were out of stock or inflating prices, Gulf Coast Business Furniture and Supply was providing local schools and businesses vital PPE supplies at fair prices. When your office needs PPE supplies, office furniture, or products to keep your business operating, consider Gulf Coast Business Furniture and Supply. We sell that too. Buy local.
SuperTalk Mississippi.
Just seems to me people have so much invested in not telling the truth.
When you want the truth.
Simply because it might hurt some feelings.
And nothing but the truth.
Lose some subscribers.
You want the Gallo Radio Show.
I just think in this audience, you still believe that if you tell the truth, you come out ahead.
The Gallo Radio Show.
And if you tell yourself otherwise, you're lying to yourself.
Mornings on SuperTalk Mississippi. SuperTalk Mississippi, your new home for the Ben Shapiro Show.
We don't hold back. We never shy away from telling you the truth.
The most electrifying national talk show on air today.
We have the most important guests and the biggest thinkers in America.
Ben Shapiro, brutally breaking down the issues of the day.
From politics to pop culture, we take a look at all of it. So don't miss out.
Weeknights at 9.
For something new and unique in talk radio, take a listen to The Ben Shapiro Show.
On SuperTalk Mississippi.
Hey, I'm Steve Azar, and you never know who or what you'll hear when I spend a Mississippi Minute with my friends. We're talking to Del Berra. Take me back to growing up and what it was like in the household with a dad like Yogi Berra.
You know, we grew up with his funny sayings. You know, I remember Dad managing the Mets, and me, Larry, and Timmy are watching the game on TV. And all of a sudden, 2 streakers run out of the stands on TV, and the camera flips away from them. So when he gets home, me, Larry, and Timmy say, "Hey, Dad, those streakers, what were they, boys or girls? We need to know." And Dad looked us right in the eye and said, "I couldn't tell. They had bags over their heads."
In a Mississippi Minute. Be sure to check out In a Mississippi Minute with me, Steve Azar, right here on SuperTalk Mississippi, the SuperTalk Mississippi app, and now available on iTunes, Google Play, and Stitcher.
The streets of downtown Gulfport will be lined with food trucks this Saturday for Ugly Tie Fest. Finally, a festival for Dad. Ice-cold beer, great live music all day, classic motorcycles, and delicious food truck food. So come hungry and ready to have some fun. Bring your dad and the whole family to Ugly Tie Fest in downtown Gulfport, Saturday, 11 a.m. to 7 p.m. Admission is free.
Talking to the people that help make the coast such a unique place to live. This is Coast Vue with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome to the final segment of Coast Vue, really dedicated today to COVID and vaccines. We have Paige Roberts, the president and CEO of the Jackson County Chamber, joining us. And you were talking about the effort that's underway. Paige, I want to share a quick thing with you. It's a little anecdote. But, you know, this notion of how to get vaccinations up in the community is something that's being talked about around the world. And I came across a story, and it's from PRI.org. And the headline says, "Beer, donuts, coupons, even golden pens." And it really, what it does is it captures all around the world efforts that are underway, from Siberia to Romania to, let's see, some of these other places, Israel, Every community, it seems, is having a conversation about how to get their numbers up. And so this is important conversations for us. We're not saying we're going to, give free beer if somebody gets a vaccination. What we're trying to find is unique approaches. A marketing plan is not just one message. A marketing plan usually has lots of components to it. Hello to your sweet daughter. I guess that's who that
Oh,
was.
It's my niece,
Your
Millie,
niece? Okay.
visiting from Philadelphia.
Hello,
Sorry.
sweet. No problem. I love the show for that reason, actually. Hey, but anyway, the reality is, though, that a marketing plan has to have multiple dimensions. It has to target people the way they need to hear the message. So it could be a complex marketing, strategic plan before it's over with. Tell me about what you're doing and where you're headed.
Sure. Well, again, everyone has their convincing point, right? Everyone does. Now, I agree with at one end of the bell curve and the other end of the bell curve, they're a yes and they're a no. But all the people in the middle, they have convincing points. And sometimes, as we saw in the state of Ohio and in the state of California, it's the opportunity to win something. And so we're talking about that because that can be fun too, right? Just the opportunity to win something. So the Mississippi Business Council here on the coast, we and Singing River Health System and some of our other members are working on some efforts to see what we might make available that people may say, hey, I'll get a vaccine for an opportunity to win that. So that's the reward. The opposite end of this conversation, as you said, Ricky, is the consequences. If you don't get vaccinated, well, your consequences could be as extreme as death or the death of a loved one. So that's how you weigh this, rewards and consequences.
I think it would be, this is something we can certainly talk about offline, but we should go to doctors like Dr. Conger and maybe some of those at Singing River Health System who've dealt directly with, in his case, in Dr. Conger's case, over 1,000 patients and, the same kind of numbers over at Singing River Health, and see if they know a family who would be willing to share their story.
Sure. The human face, or the humanization. That's what they teach us in journalism school, right? I mean, that's how you get a news story to resonate with someone, is that, oh, there, but by the grace of God go I.
No doubt about it. I mean, look, in the story that I've shared earlier, and the University of Belgrade was really disappointed with Siberia because they gave a $30 incentive for getting the vaccination, and it created a lot of distrust and whatever. And one of the things they talked about was a campaign they did to eradicate smallpox back 50 years ago, and they're like tapping into that campaign as a way of convincing people, because during that campaign they were really able to prove, and they had great results as a result of it, that and help people understand that the vaccination was for the public good. And they're tapping into that experience back 50 years ago to eradicate smallpox to sort of launch a new campaign around COVID. There may be some best practices out there that you can tap into like that.
Right. And I think, too, one of the industries over here in Jackson County is saying that if you don't get vaccinated, and whether you do or you don't, if you have to quarantine, it's on you for your vacation and sick days. So that's going away. So it's some of the companies are making it more uncomfortable and harder on you if you do have to be away, and if you have to quarantine just for being around somebody if you're not vaccinated. If you are vaccinated, you don't have to quarantine.
I've not heard that angle before. It's interesting. I've not run across that angle before, but it makes complete sense. Being a former CEO of a company, I could see insurance companies eventually saying that if you get COVID and you get, there's going to be some issues there because you had a chance to be vaccinated. Or certainly as it relates to sick leave, that seems like an interesting angle, and people should consider that. I bet that angle begins to take hold. We got less than a minute. Final thought, Paige?
just go out and get vaccinated. I know on June 24th at the Shuckers game, there'll be a vaccine event there. So it's not about access. It's about our health and our future.
We'll check in a couple of weeks, maybe sooner, as you guys kind of put some legs on your plan and share what you had to say about it. I'll keep the topic front and center on Coast Vue, and hopefully we can get the numbers up. So until we meet again, we'll see you soon, okay?
Follow SuperTalk Mississippi Gulf Coast 103.1 on Facebook. Facebook.com/SuperTalk MS Coast 103.1.